Hey, future LVNs, studying for those pharmacology exams.
Yeah, it's a lot, right?
It is. So many medications to learn, but don't worry, we're here to help break it all down.
Exactly. We're going to go on a deep dive together.
We've got your study guide right here, and we're going to make this stuff as clear as possible.
Yeah, we'll cover how these medications work, why they're important.
And what you really need to know to be a safe and effective nurse.
Exactly. So let's jump right in.
Okay, great. Let's start with a medication you're going to see everywhere, risperidone.
Risperidone, also known as Risperdal.
Right, Risperdal, the brand name. Have you ever worked with patients with autism or schizophrenia?
Oh, yeah, definitely.
This is a med you'll see in those situations a lot.
Yeah.
Can really help manage irritability, hallucinations, delusions.
It's pretty amazing how it works, actually. It targets those neurotransmitters in the brain.
Neurotransmitters.
Yeah, like dopamine and serotonin, those chemical messengers that affect mood and behavior.
Okay, so it helps to kind of regulate those things.
Yeah, exactly. Risperidone acts like a volume control, dialing down those signals when they're too intense.
So it helps to bring things back into balance.
Exactly.
But like with any medication, there can be side effects.
Right. And with risperidone, some things to watch out for are weight gain, sedation, dizziness.
Oh, and I remember from the study guide that movement disorders are a possibility too.
Yes, definitely things like tremors can happen. So it's really important to monitor patients closely.
And also to educate them about potential side effects.
Absolutely. Make sure they know to report any concerns and to avoid alcohol.
And also something I remember from the study guide is that simple tip about getting up slowly.
Oh, yeah, to avoid dizziness. That's good advice for anyone, really.
Okay, so we talked about mental health. Now, let's switch gears to metabolic conditions.
Sounds good.
Have you ever worked with patients with type 2 diabetes?
Yeah, definitely. It's so common these days.
It is, and it can be really challenging to manage.
Yeah.
So let's talk about a medication that can help rosiglitazone.
Rosiglitazone, or Avandia, the brand name. It's a helpful tool, but it's important to be aware of the risks too.
Okay, so first, how does it work?
Well, imagine insulin as a key that unlocks cells to let glucose in. In type 2 diabetes, that lock is rusty.
Rusty. I like that analogy.
So rosiglitazone acts like a lubricant, helping that key turn more smoothly so glucose can get where it needs to go.
So it helps to improve blood sugar control.
Exactly. That's the goal.
But you mentioned risks. What are some of the serious ones?
Yeah, so with rosiglitazone, we need to be really careful about the potential for heart failure, fluid retention, and even bone fractures.
Wow, those are serious. So careful monitoring is crucial.
Absolutely. And just like with risperidone, drug interactions are a big concern.
The study guide mentioned that combining rosiglitazone with insulin can actually increase the risk of heart problems.
Right. And other medications can affect how it's absorbed and processed in the body.
So it's all about that careful assessment and really knowing your patient's medication history.
Absolutely. Patient education is key too, making sure they understand the risks and benefits.
And the importance of sticking to their treatment plan.
Exactly.
Okay, so from diabetes, let's move on to a condition that literally takes your breath away, COPD.
COPD. Yeah, it can be really tough for patients.
It is. Imagine struggling for every breath, those constricted airways, and making it so hard to breathe.
That's where Spirivo comes in. It can provide some much-needed relief.
Spirivo, the brand name for tiotropium.
Right, tiotropium. So think of the airways in the lungs like those tiny drinking straws. In COPD, the muscles around those straws are constantly squeezing, making it difficult to get air in and out.
So it's like those airways are always tense.
Exactly. And Spirivo works by relaxing those muscles, allowing the airways to open up.
So it's like giving those airways a chance to finally breathe.
Exactly. And that can lead to fewer of those scary flare-ups that land people in the hospital.
That's a huge relief for patients.
Mm-hmm.
But are there side effects with Spiriva?
There are some common ones to watch out for, like dry mouth constipation and difficulty urinating.
And why is that?
It's because Spiriva blocks a neurotransmitter called acetylcholine.
Acetylcholine.
Yeah, it plays a role in muscle contraction, not just in the airways, but in other parts of the body, too.
I see. So blocking it can have those ripple effects.
Exactly.
And the study guide mentions that if you combine Spiriva with other drugs that have similar anticholinergic effects, those side effects can be amplified.
Right. So it's super important to be aware of your patient's entire medication list.
Makes sense. And since Spiriva is inhaled, you'll need to teach patients how to use the inhaler correctly.
Absolutely. Good technique is key to getting the full benefit of the medication.
Okay, so from the lungs, let's shift our focus to the eyes.
To the eyes. Okay.
Think about how precious our vision is and the impact of conditions like glaucoma.
And glaucoma, yeah, where the pressure builds up inside the eye.
Exactly.
Yeah.
And that pressure can damage the optic nerve, leading to vision loss.
That's where timolol ophthalmic drops come in. It's a type of beta blocker that helps to lower eye pressure.
So timolol, the generic name, but the brand names are Timoptic and Betamol.
Right, so imagine the eye like a sink with a faucet and a drain. In glaucoma, the faucet is running too fast and the drain isn't keeping up.
Okay, so there's too much fluid building up.
Exactly. And timolol acts like a flow restrictor on the faucet, reducing the production of fluid and helping to lower the pressure.
So less pressure means less risk of damage to the optic nerve.
Exactly. And that's key for preserving vision.
But even though we're talking about eye drops, some of that medication can get absorbed into the bloodstream, right?
Yeah, that's right. It's a good reminder that everything in the body is connected.
So you might see systemic effects, like a slower heart rate or low blood pressure.
Right, because timolol can block beta receptors in the heart and blood vessels as well.
So it's important to be aware of those potential effects and to monitor patients carefully.
Absolutely. And of course, drug interactions are always a consideration.
The study guide mentions that combining timolol with other beta blockers or blood pressure medications can have additive effects.
Right. It could make those blood pressure and heart rate dips more pronounced.
So as LVNs, you'll need to be extra vigilant watching for any signs of trouble.
And patient education is crucial too, making sure they know how to administer the drops correctly.
Speaking of which, the study guide has that great tip about pressing on the inner corner of the eye after putting in the drops.
Oh yeah, that helps to minimize those systemic effects by reducing how much medication gets absorbed into the bloodstream.
It's a simple but effective technique.
Exactly.
Okay, so from the eyes, let's move on to a medication that tackles a wider range of conditions. Valproic acid.
Valproic acid, or depakine, it's like a
Yeah.
multi-tool. It can be used for seizures, bipolar disorder, migraines.
Wow, that's a lot of different uses.
It is, and it all comes down to how it affects a neurotransmitter called GABA.
GABA. Tell me more about that.
So GABA is like the brain's natural calming agent. When GABA levels are low, things can get out of whack.
Leading to those seizures and mood swings, migraines.
Exactly. And valproic acid helps to boost GABA activity, restoring that sense of balance.
I see, so it's like a calming influence on the brain. But as with any potent medication, there are potential risks.
Right. We need to be especially cautious about liver toxicity with valproic acid.
And the study guide mentions other side effects too, like nausea, weight gain, hair loss, tremors, even a drop in platelet count.
Right. It's a lot to keep in mind. And drug interactions are always a concern.
Combining valproic acid with alcohol or other medications can have unpredictable effects.
Exactly. So careful monitoring is essential.
And the study guide recommends taking valproic acid with food to minimize stomach upset.
Oh, yeah, that's a good tip.
Yeah.
It can make a big difference in terms of tolerability.
Absolutely.
Yeah.
Okay, so let's wrap up this first part of our deep dive with a medication that's super important in cardiovascular care. Warfarin.
Warfarin, also known as Coumadin, it's a mainstay for preventing blood clots.
So think about patients at risk of stroke or pulmonary embolism. Warfarin can be a lifesaver.
Exactly. It works by targeting the blood clotting process.
Okay, so remind me, how does that process work?
Great. Well, it's a complex cascade of reactions. Imagine a domino effect, one factor activating the next, eventually leading to the formation of a clot.
I see, so it's like a chain reaction.
Right. And warfarin disrupts that chain. It inhibits the production of certain clotting factors.
So it's like putting the brakes on clot formation.
Exactly. But the tricky part is finding that sweet spot where it prevents clots without causing excessive bleeding.
And that's where those interactions come into play, right?
Oh, yeah. Warfarin is notorious for interacting with other medications, even over-the-counter ones like ibuprofen.
And even things like diet can affect it.
Right. Leafy green vegetables, which are high in vitamin K, can interfere with warfarin's effectiveness.
And the study guide really stresses that alcohol is a no-go with warfarin.
Absolutely. Mixing them can have unpredictable and potentially dangerous consequences.
So as LVNs, you'll be monitoring INR levels regularly to make sure the clotting time is within the therapeutic range.
And educating patients about the signs of bleeding to watch out for.
Like unusual bruising blood in the urine or stool prolonged bleeding from cuts.
Right. Those are all red flags.
And the study guide emphasizes the importance of taking warfarin at the same time each day.
And, of course, any changes in diet or medication should be discussed with the doctor.
It sounds like warfarin requires a lot of careful management.
It does, but it can be a life-saving medication when used correctly.
Absolutely. Well, I think we've covered a lot of ground with these medications.
We have. It's been a good overview.
Yeah, and it's really highlighted how important it is to understand not just what these drugs do, but why.
Exactly. And to think critically about those potential side effects and interactions.
It's all part of being a safe and effective LVN.
Absolutely.
Okay, so we've talked about some specific medications now.